y'all? This is Kia Chisholm from Dr. M's 10-part series, and as promised, we're going to talk about plantar fasciitis for episode 3. Now, when it comes to plantar fasciitis, please understand we are talking about the fascia that is located at the bottom of your foot and connects your heel to the balls of your feet. Now, some ways that you might be able to develop plantar fasciitis, especially my ladies, is wearing heels too often, too tight shoes, wearing worn down shoes. You can also expect your risk for plantar fasciitis to go upwards if you're overweight, obese, especially my pregnant women towards the end of your pregnancies. Typically you'll see an increased risk for plantar fasciitis. And then sometimes your hip external rotator is just too tight. So what happens is your feet begin to turn outwards and you get to develop something like a penguin walk of sorts, causing your fascia to get tightened in and also allowing you to develop the inflammation and the pain towards the bottom of your feet or towards your heel region that you expect with plantar fasciitis. Now, as far as pain levels go, well, that definitely varies from person to person. So if you are a person that's been struggling with a year plus, if it's a chronic issue, then you can expect to see pain for longer bouts of time, especially if you're not consistent with a therapy. Now, I know you're watching this video because you're ready for me to give you some information, some exercises, stretches, etc. that'll help you be able to treat this at home or with the help of physical therapy, etc. So we're gonna go ahead and get straight to that. All right, so exercise 1 is going to require you to get something like a prayer position, but instead of your feet being flat on the ground, you're gonna take your toes, you're gonna position them upwards, and then you're gonna sit down on top of your feet. And basically you'll just sit like this. The goal is to be able to sit like this for about a minute's work at a time. But I understand if you have chronic pain, then you want to be able to reset and sit back down on top of your feet. You can even treat this like an exercise and do a total of, let's say, 10 reps and 3 sets again. Now the next exercise, you can either do this with a resistance band or you can do this with a towel. You'll sit down, you'll take your band or your towel underneath your foot. You're gonna pull on it, you're gonna pull your toe. You'll wanna add just a little resistance against the band or against the towel. And then you'll relax. You'll pull upwards. And then you'll relax. Again, 10 reps, 3 sets. Make sure you're doing these things daily for you to get optimal results. Now, as far as a chiropractor goes, it's basically a common consensus that there's no adjustment that can help you with plantar fasciitis. However, for physical therapy, you can get a deep tissue massage. You can also get the ice therapy, which is them putting ice on your feet for about 5 minutes at a time. Or you can even get a tennis ball massage where they take a tennis ball or a softball, depending on the size of your feet and how much pressure that you need. You'll put it underneath your foot and they basically give you a deep tissue massage using the tennis ball. Now, your worst case scenario for having plantar fasciitis, sadly enough, is surgery. You can either have surgery to repair it if it is chronic pain, you've been consistent with therapy, you've been consistent with your exercises and stretches, and for some reason you just can't get the pain away. Surgery is going to be your worst case scenario. Next is going to be a corticosteroid shot, although not necessarily recommended because all that does is treat the pain. It does not treat the cause of plantar fasciitis. And then your last worst case scenario example would be a night split, where basically it's almost like they're putting a brace on your foot to make sure that you're getting your bones and your fascia in alignment. So over time, you can start to experience some acute relief. Thank you again for watching episode 3 of Kia Chisholm with Dr. M's 10-part YouTube series. And for episode 4, we're going to be talking about the greater trochanteric pain syndrome. Catch y'all soon.